digluma xamal la ni jar na ko xibaar bi ma la andil COVID-19 mooy corona virus lépp la àdduna li ma jaaxal nag ci moom mooy xàmmeewul bu rek baatoo la tax docteur yi ci àdduna ñoom ñëpp jóg nañu ànd ak ñun ngir xeex leen ba jàngoro ji jóg fii ci suñu askan leen Gambia Red Cross Society ñi te ñoom yónni woon te ma xamal leen ne wéru askan wi moo leen tax a jóg àdduna wërngal képp la doon séentu suñuy vision suñuy yaakaar ñu wekkoon ko ci yow andi looñu lu dul COVID-19 yow 2020 digluma xamal la ni jar na ko xibaar bi ma la andil COVID-19 mooy corona virus lëmbe na àdduna li ma jaaxal nag ci moom mooy xàmmeewul bu rek baatoo la ndax docteur yi ci àdduna ñoom ñëpp jóg nañu ànd ak ñun ngir xeex leen ba jàngoro ji jóg fii ci suñu askan yee ITC ñooy International Trading Center ñoo ne ma ni may yëgal leen ne wéru askan wi moo leen tax a jóg àdduna wërgal képp la doon séentu suñuy vision suñuy yaakaar ñu wekkoon ko ci yow andi looñu lu dul COVID-19 yow 2020 tas na suñu yaakaar billaay tas na suñu yaakaar déglu leen ma man ma joxe tegtal yi ci géeju ñu raxas loxo yi mu set te ñu moytu joxante loxo setal fa wóorul wala ca moytu ndaje mbooloo dafa wóorul askan wi nañu saytu ndaw réew mi te ñu téye leen ci biir kër yi ñu bañ a génn déglu leen ma jógtal suñ soldaar yi ci xeex bi déglu leen ma jógtal suñ soldaar yi ci xeex bi Red Cross jàmbaar ngeen yéen a ngi ci xeex jàmbaar ngeen yéen a ngi ci xeex ba guddi bëccëg ngoon yéen a ngi ci xeex Red Cross jàmbaar ngeen yéen a ngi ci xeex dem ngeen xus dem yéen a ngi ci xeex Red Cross jàmbaar ngeen yéen a ngi ci xeex bi yàlla teggi ñu tiis wi yaay borom yërmande
Good evening to all our followers. Good evening, and thank you for joining this live video. We are broadcasting live from the COVID Gambia platform. We are back on air tonight to discuss, to update you and to discuss about the situation of the COVID-19 in the country. Thank you for joining. I'll just allow a few people to join, few more people to join before we go on with the discussion. Keep joining this live video. We'll just allow more people to join before we start with the updates of the figures that we've just received from the Health Ministry regarding the COVID-19 cases in the country. And we'll go on with other discussion also as part of this live. Thank you for joining. Thank you for joining. Thank you, Marilyn. Thank you for being here again tonight. It's good to have you here. Thank you for joining. You're a keen follower of the COVID Gambia page, and I hope that you're benefiting a lot from the information we are sharing here. Thank you. Well, we'll start with the figures of the day regarding the COVID-19 situation in the country. The figures are 2 days behind, like we've explained during our previous lives. Seems as if the health ministry is not up to date when it comes to registering the figures. So they are a little bit late in providing the reports, meaning that the figures that we're announcing today are of 2 days ago. Okay, so as part of those figures, it seems as if there are 9 new deaths registered and 183 new positive cases, 183 new positive cases and 9 new deaths registered. There is a total of 54 recoveries so far, and still 1,408 people considered active COVID-19, meaning that they're still carrying the virus within them, and there are 1,408 active cases at the moment. And you still have 332 people in quarantine. I'll go back on the figures. As of the 14th of August, and those figures are on as of the 14th of August, meaning 2 days ago, there are 9 deaths that have been registered, a total of 183 new positive cases, 54 new recoveries, and 1,408 active cases, and a total of 332 people still in quarantine. To really go in depth with these figures, we have Modunjai MS, who is here and will be joining us via audio to really look into these figures and do a little comparative analysis. MS, are you here?
Yes, I'm here, Bintou.
Over to you. Everyone. Over to you for the analysis of the figures.
Yeah, thank you very much, Bintou, for providing the statistics for today. Well, as you rightly stated, when we say today, it's like we're two days behind, as per the way. I mean, this is the way the Ministry of Health provides this information, which is also kind of a concern to many, because it means we are not getting real-time information. So we are always going a step back.
Indeed.
As you rightly stated, the figures are going up, having 183 new cases and 9 new deaths. Really, it's really alarming. But to really put things into perspective, we don't need to look any further. Just to do a little comparison with our neighboring country, Senegal. As you know, the pandemic is also very is affecting them seriously. But the interesting thing about Senegal is that out of a population of 16.8 million, with a total of 19 case counts, that is 12,000. They have a total of 12,022 cases, which, when you break it down, it means from every 1 million, you have 1,400 cases. Every 1 million Senegalese citizen, you have 1,400 cases. Then you compare that with the Gambia. In the Gambia situation, our population is roughly 2.4 million, with a total confirmed cases to date, that is to say 2 days ago, 1,689. So when you do the ratio, it becomes 1,411 per million. Indeed. Now, this is very interesting, but also alarming. I mentioned let me go back to the Senegal ratio. That is 1,400 cases per million. Gambia is 1,411 per million. So in terms of ratio, really, our situation is more severe than even that of Senegal, even though they have a higher population. When you do the mathematics and break it down, our situation is more severe. So this means that one is more likely to catch COVID-19 in the Gambia than in Senegal. In
That's
theory,
quite
that is based.
interesting.
Yes, yes. Based on these statistics, that is the fact. So it is safer to be in Senegal. Okay, but then again, we're just saying that Senegal has a case fatality ratio of about 2%. That is only 2% of all these cases actually end up being fatal. That is, they lose their lives. While in the
Yes.
Gambia, it's 3.2%. So it's even higher. The fatality rate in Gambia is higher. So we need answers to these things. We need to know why. So one is more likely to die in the Gambia than in Senegal, based on these statistics. I'm not basing on anything else, just based on these statistics. So and the other interesting thing is, or alarming thing, is that in Senegal, 60% of the cases have already recovered. They have a recovery rate of 60%.
That's
And I've
interesting.
read, exactly, and I've read somewhere it's one of the best recovery rates in Africa and even beyond Africa. So they must be doing something right.
Really
And in the
interesting.
yeah, exactly, exactly. And then in the Gambia, our recovery rate is at 20%. That's really abysmal. I mean, 20% compared with 60%. We really, it's mind-boggling. We don't know what is the reason behind that. So we are more likely to stay sick and remain admitted in the Gambia than in Senegal. So in the Gambia, also the testing is very low. While the Gambia, the testing is about 2,600 per million, Senegal is 7,700 per million.
Okay, and how would you
Yeah,
interpret that in terms of capacity, or I don't know, how would you
yeah,
how would you translate those statistics?
yeah. I think it has to do with capacity. I think maybe we lack the human resource base to carry out more and more tests per day. In Senegal, I'm sure they have so many test centers and things of that nature, but it really shows that we lack the capacity, and it's really serious, because what it tells us is that you see, if the testing, if the number of testing that are being conducted is so low, obviously the number of cases will also be low naturally. It's going to be low, but
Okay.
that's not realistic. We all know that the cases are higher than what they are, or what they're being reported as, because the only problem is that we're not doing enough testing. So this is
And in fact,
a
and in fact, the tests are not being conducted cross country. I mean, it's just in
exactly
a certain
ex
portion of the country, I would say. So
yeah,
as it stands, we still have no
yeah,
clear vision or no clear data when it comes to the state of COVID-19 in the Gambia.
rightly so, rightly so. It's really not a truly reflective status of Gambia's COVID-19 situation. It's just a portion of Gambia that we're looking at, and that we've been looking at for the past 3 or 4 months. So I think it is very, very critical and very, very urgent that the ministry and the government look into ways and means of extending this testing to cover the length and breadth of the country, so that we can have timely and accurate and reliable data that we can rely on. But right now, the data is it's skewed. You know, you're talking about only Greater Banjul. We don't know what's happening in other areas. So it's really worrying.
Yeah,
Yeah.
indeed. Yeah.
So I'll
Well,
hand you
thank you
over
so
to
much. Yes, thank
Yes.
you, MS Modunjai, for taking part, and thank you for analyzing these figures. It's very important for people to also have beyond the figures that are being reported by the health ministry. It's important for people to also have clarity as to what those figures mean. So thank you so much. Modunjai is part of our team here in COVID Gambia. Thank you, MS. Over to you, Manyenya Dambel. Thank you for joining. You are here tonight.
Thank you for
My
having
favorite
me. Good evening,
co-host.
viewers.
Good evening, good evening.
Good evening,
Good evening.
viewers. Sorry, I had some technical issues, not Nawek, but can you hear me, Bintou?
Yeah, I can hear you clearly.
Oh, perfect. Yeah, I had some technical issues, which has been sorted now. So thank you for having me.
Excellent. Great to have you.
I've just been listening to what MS was just saying, and it is really, really scary. You know, it's just unbelievable. That's what the figures are at the moment. When Senegal has a recovery rate of 60%, and ours is what, 20? Did he say 20%? Or 30%? What did he say?
Something like that. 30, I think
Something
he said 20%.
like that. So yeah, that is quite scary as well. So yeah.
I mean, if you remember, sometime last week there was lots of discussion regarding maybe the Gambia, the Gambia seeking for help, especially towards from our next door neighbor, which is Senegal, and some ministries actually debunked that information and said that it was not true. The Gambia has never solicited any help from neighboring Senegal. But going forward, we wonder, I mean, if this is something that should be explored, because as we know, the entire world is almost, I would say, the entire world is struggling with the COVID-19 as it stands. So wouldn't it be wise to just at least look for expertise next door with your next door neighbor to see what they are doing, or maybe try to look at ways and means that they are utilizing to be able to contain or to be able to reduce the mortality rate? I don't know. What do you think?
Absolutely, I totally agree. There is no shame in asking Senegal for help. There is no shame, absolutely. If they've gone through it and they've got a recovery rate of 60% and we've got a recovery rate of less than 30%, I think it should be good for the government to speak to the Senegalese authorities and see what it is that they're doing and see if we can replicate that in the Gambia as well. So right now with the COVID situation, I believe there is no shame in asking for help should you need help.
We know that all countries are busy at the moment taking care of their own situation, but I believe that expertise can be shared within the ECOWAS region especially. There are some protocols that have been revealed and that have been dispatched when it comes to regulation or when it comes to measures that ECOWAS countries should be sharing or should be applying in their own countries. So I think that sharing information and also sharing strategies probably could also, if it's not yet included in the document, reading it, I believe that it was actually mentioned there that countries should collaborate together to see ways and means to curb the spread of the COVID-19. So if one country has a certain solution that's potentially working, it's all in our benefit to try and reach out and get that solution so we can possibly explore it on our territory. I'm sure
Absolutely.
that this information will reach the authorities, and it's important to listen to the population and to suggestion and also advices and probably do the right thing.
Absolutely. We're all in this together, Bintou. We're all in this together. And when I mean all, I'm not just saying the Gambia, but also the whole world. I think we can look at other countries and learn from what they've been through, because I know that when there was a surge in Rome, for instance, in Spain, and also China, other countries learned from their experiences to sort of like curb what is going on and try and do as much as they could. So I think we need to learn from other countries, basically. There's no shame in talking to Senegal and saying, this is what's happening in your country. What can we do to replicate what you're doing so we too can save lives? So I think that is very crucial at this moment in time.
Indeed, it is. And the situation is quite worrying. In fact, with no exaggeration, I mean, when we look at the figures that are being produced by the Health Ministry, and when we consider the fact that this is not representative of the entire territory, the entire country, then we can only imagine what would come out if we were to test the population on a wider scale. so it's quite worrying indeed.
Yeah, I think the testing is very important. It's crucial that people are getting tested. And also, I believe, is it just a Ndemban clinic that are doing the testing in Gambia, or have they got other places where you can go to do the testing? Have they got other areas where you could go to, or is it just Ndemban clinic?
For the testing, as far as we know, it's only at the Ndemban clinic for now. I mean, the testing officially have been announced to be carried at the Ndemban clinic in Bakel.
Yeah, because the testing is very crucial. And also to the citizens as well. Don't be scared. Just go get tested. It is very important for the government to also know who's got it and who hasn't. The testing helps to curb the surge as well. So I don't think ninyo war nañu ragal di fokk ne hey buguma testi suma demé ñu wax ma bad news, like at least so demé nga xam you could start the process of getting healed from this virus, rather than fever and you can't get up. So if you have the opportunity to do so, I urge Gambians to go and get tested, and it's free of charge as well. They're not charging anything, are they?
That's something that we need to verify. I believe the tests are free of charge, but I'm not quite sure, so I'm not going to say anything in that regard, but we'll verify. Yeah. Yes, we'll verify and get back to get the information on the platform once we clarify, okay? Because there was, yes, I mean, I'm not going to mention anything regarding the cost, but I think that there's a cost related to the testing. That's to be verified.
Is that okay? Okay. No, that's fine.
Yes, so for the benefit of our followers, it's important to mention to you that you also have the possibility to watch us on YouTube live, and then in that way you can watch it on your screen if you have a smart TV. So just to let you know, you just type COVID Gambia on YouTube and you'll be able to access our live stream and view it on your big screen if you have one. Okay, that's just an information I thought I would share. Okay, so
Bintou, have you done the figures then? You've done the figures already?
We've done the figures. MS was on board and he tried to understand a little bit analysis about the figures. So we'll move on to another topic regarding the fumigation, just some news that we are privy of regarding what activities have been going around town regarding this prevention of COVID-19. We know that the Red Cross has engaged in some fumigation activity across various markets. And what's interesting in this is that I don't know if it's for the first time, but it seems like it. The markets that they're mentioning this time are Sukuta, Brusubi, Nemakunku, Brufut, Gunjur, Bulok, Somita, Buyam, Sibanor, Kalayi, which is very interesting because during the past fumigation exercises, I had not seen like the phony, for example. It's like it was limited to some markets in the Greater Banjul area, but we can see from this information that we've gone beyond the Greater Banjul area and we've entered the phony now, because Somita, Buyam, Sibanor, Kalaji, Bulok, all those are phony villages. So that's quite interesting.
Are they fumigating the village itself, or are they fumigating like the hospitals or possibly markets or that sort of thing? Are they choosing areas where they're going to fumigate?
I think for now they're fumigating markets. I mean, that's what
okay, so it's just the markets that they're doing.
It's just the markets. I mean, that's where lots of people converge. So I think it's necessary to conduct some fumigation exercise once in a while to ensure that COVID does not take a seat in one of those markets. So I think that's what the Red Cross has been busy doing, which is as part of their mandate, the emergency preparedness and response. So they're trying to ensure that people are safe and secure, especially in markets. Okay. So as it stands, they are collaborating with the area council, and they're fumigating Sukuta Market, Brusubi, Nemakunku, Brufut, Gunjur, Bulok, Somita, Buyam, Sibanor, and Kalayi. Okay? So as part of the fumigation exercise also, we've seen the information that they're also fumigating some schools, about 175 senior secondary schools across the country. And I think they're doing that ahead of the grade 12 exam. If you remember, sometime last week, when the last state of emergency measures came out, we saw that all schools will remain closed except for the grade 12 that will be allowed
so they
to
can do their
go back.
exams.
Exactly. So to ensure that those students are safe, which we hope is going to be the case, the Red Cross has embarked on some fumigation exercise in about 175 schools across the country. So we can clearly see that the Red Cross is really active on the ground, and we really need to commend them for the amazing work that they are doing. I think that we never miss an opportunity to mention it during these live videos that we do, because I can't just imagine what would happen if the Red Cross was not this efficient and active on the ground. I just cannot imagine. So yes, really kudos to the Red Cross really for the amazing job that you're doing. The Gambia is grateful.
Absolutely. Red Cross are doing commendable job. You can see like they've been retrieving the corpse, they've been fumigating, so which is absolutely amazing. So thank you to the Red Cross and also to the health workers that are doing excellent, to be honest. And kudos to all of them.
Indeed, indeed. I had seen an information regarding KMC engaging in some fumigation exercise also. I'm just trying to confirm where exactly. Yes, KMC was engaged in some fumigation in Latrikunda Sabiji market today. In fact, that's the information that we retrieved. We came across from their page. They were engaged in some fumigation exercise in Latrikunda Sabiji market. So that's quite, I want to say that's a bit reassuring for the population to know that these fumigation exercises are happening. It's really important to fumigate every now and then, especially in areas where you have a mass concentration of people on daily basis. This is the type of thing that COVID appreciates. COVID loves for people to gather. This is a way for it to get through to people. So fumigating every now and then is a very important exercise, and KMC has been doing it around in the Latrikunda Sabiji market today.
Okay. And how regularly are they fumigating? Do you know?
Well, I do not have that.
The government guidelines, because I know they said the markets, they'll be fumigating it. Is it once every week? I'm not sure what the government guidelines was when they had the state of emergency.
Well, we monitor regularly the Banjul City Council, Kanifi Municipality Council, the Red Cross, and that's how we get the information regarding these fumigation exercises. So we'll keep on monitoring and informing people. I think people might feel a bit more reassured to probably go and do go and buy their groceries at the market once they know maybe that these fumigation exercises happen. At least it's a bit reassuring, because I know that if I know that the Brusubi market has been fumigated, or the any other market, I think I'll be more willing to go there to buy my little groceries in the morning quickly and get back home, rather than going to a place where I see a mass concentration of people and no sign or no information about that place ever being fumigated.
Yeah, I think it's a good thing as well for those people who don't really believe that COVID does exist. When you see that the authorities are coming into the markets and fumigating and doing all of these things, which possibly it's not something that they used to do regularly. I think for them to see that this is being taken seriously can help also to encourage those people to adhere to the guidelines that has been set by the government. So it's a good thing for them to see what's going on. So it shows the seriousness of what's happening in the Gambia at the moment.
Indeed. But it's very important, and we're happy to be able to at least get this type of information from be it the KMC, be it the Banjul City Council, be it the Red Cross. At least they update regularly on what they are up to, what measures or what exercise they are conducting on the ground, which at least this is what helped us to also share information with our followers and let people know about what is going on around the country. So they're really doing a great job.
They are, definitely.
We have lots of questions on the question column, Nina. I think that we should try and answer some of them.
Yeah,
maybe
the comments, yeah.
We'll let our moderator just bring them on the screen as we go. Okay. Moderator, if you can just bring the questions as they come, and we'll try to answer the ones that we can answer. As we always say, we only answer what we can, but what's in our capacity, I would say. Joby Jones, thank you for being here tonight. My question is why most of the deaths are diagnosed post-mortem? I'll let you answer, Manya.
Joby Jones, thanks for the question, but unfortunately, I'm not on the ground, and that is a question for the health authorities to answer, because I can't answer that. Bintou, can you? I don't know.
I can't really answer because it's a medical related question, exactly. But I will just speak based on what I know has been happening on the ground lately. The reason why I would say that some corpses are being diagnosed or tested positive post-mortem is because not everybody dies in the hospital. Lots of people die at home. So what happens during this COVID period? People would then contact the authorities, who would send some frontline workers to collect the corpse. And once the corpse is collected, obviously it's already a dead corpse. What would they do before burying the dead? They would conduct a test on that person to check the cause of the death or not. It's not an autopsy, but it's just a test to check if that person is actually COVID positive or not. So if that person happens to be COVID positive, they will register it as one more case or one more COVID-19 related death in the Gambia. So I think this is what is happening, obviously.
Okay. There's another one. I have heard Senegal has been put back on lockdown again. Is that correct? And it's from Marilyn Pendergrass. Hi, Marilyn. She's always with us. So thank you for joining us again, Marilyn.
Yes. Well, when it comes to the Senegal situation, we are not really monitoring closely. I mean, we receive some reports every now and then, but as it stands, we've not received the news regarding. I heard about that news last week, but I don't know if it has been effective and the lockdown has taken place. So I'm not sure, but we will verify, and I promise to bring you that answer tomorrow.
Any more questions, or is that?
Okay, I'll read that one. Wala Bargi, thank you for joining the live. Thank you for your support and accolades to the Gambia Red Cross. We're proud of the volunteers engaged in different activities, fumigation of schools, offices, health facilities, etc. Safe and dignified burials of COVID-19 victims, community sensitization, etc. Thank you for your renewal, the public. Thank you for sensitizing the public. I think that's what you wanted to write. Keep it up. Thank you so much, Wala. Thank you. It's much, much, much appreciated. This is the type of comments we like to receive. We get feedback from you. It helps us to improve the quality of what we're doing every day, and seeing that you're following us also is very encouraging. So thank you so much.
Yeah, and also, Bintou, with what I've seen so far, the fumigation and everything else, it seems like the government is putting things in place bit by bit, So it's quite encouraging to see these things are being done, and especially because the last time we spoke, we did say what's happening in the rural areas, because the focus has been on the urban areas. So this is quite promising, what I'm seeing at the moment. We haven't found the cure for COVID yet, but at least the government is doing its best to try and limit, what's been happening on the ground thus far. So hopefully they would speak to Senegal and see if they can get some tips, so to speak, on, how to curb it even further.
Well, I'm sure that the government is doing he's putting up lots of efforts to fight this COVID-19 in the Gambia. But as they've clearly stated, capacity is lacking. We have lots of frontline workers and lots of healthcare workers that have tested positive, and that has reduced the capacity, an already very fragile capacity that the healthcare system of the Gambia had. So added to that, the COVID-19 I think that we are in a situation where, despite the efforts that the government is trying to put through, it remains a very fragile and very sensitive situation as it stands. When we talk about the PPEs, when we talk about fumigation exercises, all that is done. But do we know the scale of it? Do we know if that is done beyond the Greater Banjul area, going, like we saw clearly that the Red Cross is fumigating the Foni area, but what is the capacity of the Red Cross? How many villages in the Fonis and beyond Fonis can they fumigate? And how safe is the population without fumigation of other markets cross country? Seeing that there's movements of people going on also, so all those things are cause of great worries as we speak, and the figures are clearly showing it. There is clearly something not efficient going on in the country regarding the handling of this COVID-19 situation. There's clearly something, and we need to put our fingers on it so that we can seek for the right type of health and really cut down the trend of death that is currently going on in the country. And the infection also, when you look at the figures, you can see clearly that the rate of infection is fluctuating. What does that say? I mean, we were at clearly something like 69 cases yesterday, more or less, and then correct me if I'm wrong. And then today, back again with something like above 183, more or less, and getting close to 200 cases. I mean, this is, we don't understand really what is going on, and it's important for the authorities to also let people know what is the cause of this fluctuation regarding, is it due to the behavior of people? Is it due to something that people are not doing rightly? I don't know, because we're talking about community transmission, and we are supposed to be under a state of emergency with strict measures. So something is fundamentally wrong, and we need to know.
Yeah, I think the government needs to up their game with regards to the testing. Just having one place where you could go and get tested, I think that is not making it available for other people. And like, for instance, what you just mentioned with regards to the other areas, because we can't just focus on the urban areas, we need to think about beyond Brikama and, the rural areas. So, we need to make sure testing is very important. If you look at what's been happening in other parts of the world, testing has been very helpful. It has helped a lot, and I think the government needs to up their game. Just having it done at Ndemban Clinic, 2 million people in the country, the testing needs to be looked at thoroughly.
Yeah, we'll try to have more information in that regard coming from the health ministry. We will really try to focus on trying to find out what is going on with the health ministry regarding this testing, regarding the mortality rate, and regarding all the issues related to COVID-19. I think that we would try to reach out to an authority within the health ministry to try and get better updated when it comes to all these question marks that we have.
Yeah, definitely.
As part of the information that we gathered, there was a situation also that many people commented on. It's regarding a young boy that was found, I think he had collapsed, actually. That's how I understand it. It happened on Friday. It happened last Friday, actually. Somebody alerted one of my contacts that a young man had collapsed and was laying down flat in front of a shop, something like that, okay? So apparently the people who were really concerned, and especially the young boy, the man who saw this person collapsing, contacted different numbers, especially the 1025. That was the first number that this man contacted to try and get some help. They were told that they could not actually attend to the guy who had collapsed, and they also tried to reach out to the Red Cross, who told them clearly that it is the mandate of the frontline workers, so you need to clearly contact the 1025 and they will take it forward. So I don't think that any help was able to reach the young man who stayed lying down there for hours without anybody attending to him. So at some point, the 1025, somebody from the 1025 that they managed to get on the line told the young man who called that they should carry the person to the hospital. I mean, that's kind of shocking coming from the 1025. So I thought that it was, I thought that it was very interesting. It would be interesting to bring this here because I'm sure that beyond the COVID-19 affected people, you still have some other people who are sick around town or who need medical assistance. So what happens when it's a person who is between life and death and cannot just carry themselves to the hospital, or you're not sure of what they have? We're in a very particular context when you know that clearly nobody is going to get close to this person because they all suspect that he might be COVID-19 positive. So what happens?
Yeah, I think I read that because you did send me that as well. And it's quite worrying that they had to call different numbers that the government has put out there to say these are the numbers that you need to call if this happens, and they didn't get the help they needed. And obviously you can't leave it to the community. When we're talking about community transmissions that are happening all over the place, people are afraid, they're scared. We're asking people to isolate, we're asking people to call 1025, and when they call 1025 they don't have the help that they require. That individual that was there that called 1025, is that person a relative? Who is that individual? Maybe he was just a bystander that just witnessed something, and you want that person to take responsibility of a patient who might possibly have the COVID virus. So I feel like, yes, the 1025 number is there, but there has to be a process. There has to be, okay, fine. If they call, we're going to call either the Red Cross or possibly would call the police, or, you know, if the Red Cross is not available because they're overwhelmed as well. So if they're not available and you've got somebody collapsed somewhere where there are loads of people surrounding that that individual, what are we going to do to get that person from that environment and stopping from it spreading? Because all it takes is somebody to go close, wanting to help him or touch him, and then after that person is going to go home or something else is going to happen. So they need to get a special unit. That's what I think, within the police, just in case if you don't have, you try to get to 1025 and you can't. These people are trained so they can come and collect that individual, not say to the person, you know, they're going to pick the person up. We don't know how many people are going to pick the person up, whether it's 3 or 4 people that are going to help him. They're going to put him in a taxi. The driver's going to get infected, right? They go to wherever, to the hospital or whatever. It's people are going to get infected along the way. So from that where they pick the person up to wherever they're supposed to take him, how many people would have gotten infected? You know, so I think there should be a process rather than, it was quite sad when I read it and I'm thinking people are helpless. If the 1025 is not working, people are just going to think, I'm not going to call 1025. And what's going to happen next? The next phone call would be them calling Red Cross to say there's a dead body.
And in fact, I mean,
people would have gotten infected.
Indeed. And in fact, the worrying part here, I believe, is either misinformation or a lack of access to information in this case, I think. Because I think that people are not very clear about what the mandate of the Red Cross is and what the 1025 is there for, okay? So I tried to reach out to the Secretary General of the Red Cross to try and get a little bit of clarification regarding the mandate of his team. And what he had to tell me is that all interventions are through the Ministry of Health and their 1025 number. I think that's very clear. All intervention are through the Ministry of Health and their 1025 number. They have a response team that takes care of this. Okay, so it means that if there's anybody that is in distress or that's going through some sort of health issues and we do not clearly know what the person has, the Ministry of Health has a unit that should be dealing with this, and that unit can be reached through calling the 1025 number. According to the Secretary General of the Red Cross, this is actually the rule, you know, this is actually the rule.
So basically they need to call the 1025 number, and then the Red Cross has a response team that would be contacted to come and do what they need to do. That's
exactly.
the process.
So I clearly ask the Red Cross what is their mandate and in which case do they intervene, because it's important to clarify that to the population, because I mean this is a situation where people are a bit confused. We don't know which is which sometimes, and this is a situation that's quite alarming. People are stressed, they're frustrated, they are worried. At the same time, information is reaching people, but sometimes we do not really make sense out of it. So it's important to try and clarify and each and every actor's role, what the Red Cross is there for, what the Ministry of Health through their 1025 number are there for. So the Red Cross intervenes in case management. Now, he said that the case management is the responsibility of the Ministry of Health, meaning that any case related to any health issue is the responsibility of the Ministry of Health. It is not the responsibility of the Red Cross, okay? And then the Ministry of Health will ask the Red Cross to provide ambulance in case they cannot. I think that's very clear.
So the Red Cross should be the last resort.
It is not up to individuals to seek the help of the Red Cross. It is the Health Ministry that has that authority to seek help from the Red Cross. Okay?
Yeah.
We don't treat or deal with case management. That is very clear. Once again, the Red Cross is not there. That is not their mandate to treat case by case. That's not their role. Okay? They have a clear mandate, and that is what they go by. The rest is of the resort of the Health Ministry. Okay, these case-by-case management, if somebody is sick, somebody has collapsed, somebody is in the market and has collapsed in front of a shop, it is the role of the Health Ministry to bring out a response. Are they going to contact the Red Cross, or are they going to send an ambulance themselves? All that are things that the Health Ministry can or should be dealing with. And I think that it has to be clear to the public so that people know who to contact in case of what type of scenario.
But we need to understand as well, Bintou, the reason why if you call 1025, which should be managed by the Health Ministry, and you cannot get through to them, who else would you call? Red Cross.
I totally understand. I totally understand. But
you will call Red Cross. So the Health Ministry have to do their bit too. Everybody, for this to work, every individual or every the Red Cross, the Red Cross are doing their bit at the moment. The ministry have to do their bit. Get your 1025 right, or have a team that would be ready. If something like this happened, they'll tell the people who call exactly what to do to isolate that individual. Don't touch the individual. You know, is he breathing? Don't touch him. We're on our way. And there should be a response whereby within 15, 20 minutes, they've got somebody there. That should be made available. And I think we can't just say there's a 1025 number. A 1025 number, and then Manyenya Dambel doesn't know how to tell those people what to do, how to isolate or whatever. All they know is, oh, danga fair, but okay, wow, and that's it. We have to have people
self-isolate.
Self-isolate. We need to have people who understand COVID. We need to have people who know what steps that that the individual needs to take, not just isolation. In any case, understand that. So you can't just depend on the Red Cross. And you can't also just focus on, we're overwhelmed because there's too many people in the hospitals. But the 1025 as well, because you've got more cases coming on. So you need to make sure that your 1025 number is working, and there's an alternative number. Last week, or was it a couple of days ago, we did mention the alternative number. Still, I'm not sure if it's working or not. So in that case, what happened to the boy? Did they end up getting the boy? What happened?
I'll get back to the story. As a matter of fact, to just bounce back on the 1025 number, the Ministry of Health has just issued a press release this evening saying that they would like to inform the general public that all 1025 calls to mobile phones have been diverted to Gamtel landlines, and as such, it has been realized that calls from QCell and AfriCell lines are not going through the 1025 toll-free number. due to technical challenges. And they want to assure the public that the problem will be sorted very soon, but in the shortest possible time. That's how they put it. And they are really sorry for this inconvenience. But this is a really serious situation, in fact.
We understand they're sorry. That's good. Well done. Bravo. What we need to know is, what is the alternative? 1025 is not working at the moment. COVID is not pausing. Infections are happening. People are getting, infected. So we need to know, okay, 1025, fantastic. You've apologized. What is the alternative?
What is the alternative? Yes.
When something like that happens, what else should we do? Because the Red Cross is saying that they can't just come out. You as an individual, a member of the public, can't just ring them. You need to speak to the Ministry of Health. So what is the process whilst we're waiting for that to happen? Are we just going to sit down and wait for somebody else to die on the street? And then we call Red Cross and say, I'm not good. So we can't have our citizens just dying on the streets. We can't have our citizens just, understand, people are scared. People are very scared.
As it stands, really, I mean, and I think this type of press release will increase the fear and the stress and the panic among the population. Because yes, it's clear that now people know that in case of anything, there is no emergency number that they can reach. If they are from the AfriCell or QCell, they have an AfriCell or a QCell line. So what is the alternative? I think that is what the Ministry of Health should try and inform the population about, so that meanwhile this inconvenience can be sorted, but in the meantime people can still know where to who to reach out or which number to contact in case of an emergency or in case of something that they need to inquire about. Because this 1025 has clearly shown that for a while now there's been reports coming from the ground about this 1025 number that is not either accessible or where people call and have no answer. I know for a fact that the health ministry is working really seriously with the private sector to try and resolve this issue, but the population needs an alternative as it stands. The population cannot be waiting for this issue to be resolved. They need an alternative, and that's the alternative that we would like the health ministry to bring forward to reassure the population and for the population to feel safe, simply.
Yeah. Also, one point that I'd like to make, because obviously the 1025 number, it would be a call center setting. How are they collecting data? If somebody calls and they've given information saying this is what's happened to them, do they follow up that call? Do they call the individual again and see, did they isolate what has happened? Have you, what are they doing in that sense? So just getting a 1025 number doesn't mean for somebody to just ring and say, oh, I've got the thing, okay, isolate, and that's it. No, we need to follow this up, because this is how we're going to keep track of what is going on as well.
Indeed, I think there was a process at the initial stage of the COVID. So I want to believe that it's either that the line started getting congested and lots of too many people calling. At the beginning, there was a proper process. There wasn't so much negative reports coming out regarding the 1025. So I believe that there was a process. People were being attended to. There was follow-up being done. The process was on. In between, I don't know what happened. But clearly there's something to review regarding these emergency numbers and the response brought after somebody calls, So to bounce back on the Red Cross, sorry, to bounce back on the Red Cross, its mandate, according to the information that I got from them, they only sensitize and support. They only do sensitization and support, and they are there to sensitize and to support the Ministry of Health. Okay, and the Ministry of Health is there to do case management. Okay, including treatment and testing. I think that's very clear. Yeah, the Ministry of Health's mandate is to do case management, testing, and treatment. Okay.
I think what they should do, what the ministry should do, just choose the people that are being chosen to do the 1025, those who answer the calls, I think they should get trained by the Red Cross if it's possible, so that the Red Cross can tell them what to do and what processes. We can't just have just any person just picking up the phone and telling us, okay, yo, isolate alango, and they're not doing the correct procedures. They're not taking data. They're not finding out, doing follow-up calls and that sort of thing. So they too need to be trained just in case. So if I'm calling
they are being trained. In fact, they are being trained.
Okay,
I think
perfect.
The Ministry of Health has updated the population on the fact that they are training more people, because clearly capacity was lacking. And like we said, lots of frontline workers, lots of healthcare workers, some people from the 1025 tested positive. So that has greatly reduced the capacity of the Ministry of Health in terms of bringing a response to this situation. But I know that training is currently going on to really train more personnel, more staff, to really bring out a more effective response. Okay, but what we need to know is that the Red Cross is there to bring out a response triggered by the Ministry of Health, meaning that based on what the Ministry of Health has done, the first stage would be for the Ministry of Health to conduct its operation, and the Red Cross would then intervene to take care maybe of a dead body, to collect a dead body, or to conduct a burial, okay? But when it comes to case management, it's not the Red Cross that people should call. Clearly, that is not their mandate. They would not intervene.
1025 and any alternative numbers that they have. If the alternative numbers are not working, the government needs to let people know what they have to do. Because I believe in that story that you mentioned, I read they called the police and the police says, no, it's not our mandate. They called the Red Cross and the Red Cross said, well, basically, we need to follow what the government says, as in, if like you just mentioned now. So you need to go through the government. So if you're not getting through to those individuals, or, the sector that's supposed to be taking care of that, then you're always going to go to the Red Cross, and then the Red Cross is going to get overwhelmed. There will be dead bodies all over the place that they need to collect, and I don't know. It's we need to get a process done. We need to get
Yes. So
this one of those things. It's frustrating, but yeah.
This information is quite important actually for the public and for the benefit of the non-English speakers, I would say, our fellow Mandinkos or Olaf or Fuller. We would just do a brief summary for them to understand the role of the Ministry of Health versus the role of the Red Cross. So if you want to do a brief summary in Wolof Manyenya, I would just do the Mandinka part.
Okay. So mbokk yi lu ñoo jéema wax mooy ne su dee da ngeen am emergency da ngeen war a call 1025 number bi soo leen callee 1025 number bi ñoom dinañ leen advice pour wax leen lan ngeen war a def after loolu. So yéen niidu leen pour call Red Cross bi directly 1025 ngeen di call, te soo leen amutee 1025 number bi am na yeneen number yoo xam ne government bank ko provide yoo xam ne mun ngeen leen di call si number yooyu, and then ñoom dinañ leen advice. So munul leen di call Red Cross bi direct, because Red Cross gi ñoom lu ñoo mun di def mooy ne government bi su leen waxee ne am na dead body bu nekk feena o am na loo xam ne ñoom waroon na ñoo dem attend ko, then ñoom dinañ dem. I think that summarizes what I should say, right?
Yes.
Bintou?
Indeed, yeah.
Okay.
Yeah. So mbadi mandinkol nkom kamen fojan angale kan wala nkonga fasare ka tumobe manke angale kan muelati nkamen fojan wala nyinti ko mo jamal beje men yalon ko ka 1025 number nyinkol wala number nyinti me yalon ko masakunda ya londi saje momo yalon ko ya fil ko asike corona le bela covid-19 symptom wala nyinti ko ya fili balo ko no le ko asike fenne bela me yalon ko ma kalongolon wala jahal kudole be da me alon ko isula tale pour ka ko ini moya ko kacha menketa jata kende ala karola 1025 number nyimbe jele wala nyinti number me alon ko man sakunda ya landi bari kuma kan jamala ka bonan sate ko no dulal to tari mol ba fola ko 1025 ni akol jama mo bukasika wala ibuka sotono. o kuonyimbe mol jahalli mbakele katu nin jahaloɓe kerin mol malon e ñanta nomba men kolla wala nomba me alon ko iɓe laarin ko ɓe mako e rosotola wolto ni wo nomba mo masika wala o nomba ñi probléme o soto sila molta alon nola sila e ñanta e kuntilinna ɗame say do jamalɓe je fanay camera ko red cross wo simako e ro fenanne ni al muwe ko mo ketutale wala sasale be mola me alon ko albe sobirinne ko asike aketa covid-19 neti red cross binale para abuka ke wonyama red cross amanke red cross la do kuoti wo manke red cross la do kuoti ko kunata silola me alon ko sasale be mola me alon ko anin covid-19 ni muluntale 1025 ni mol nyanta wala kolla ini moydi amu me alon ko ba fole ne nyanta menkela sai jata kenda bunda la ministry wala bina solution o fela nan fero fela nan ka jibe be nyin ko nyin jibe la nyame fo isina fero fena memba tina o mari sitanka wala isina samba jaradula bari akamta ko health ministry nyine bina red cross contact la natara furele be moya red cross le bina health ministry le bina red cross contact la health ministry na red cross nyin contact red cross sina fure nyin kamma natara bade o fana nyanta kela red cross sina o bade nyinke barka fo ko be nomba nyine kolla wala mbita red cross le noma e binale ka to mole ketuta wala kule keta o nyama red cross manke o manke red cross la do kuoti so akumaya tale mol fana ya kala muta o nyama ko jata kende abunda la ministry wole be mararin o kusi falla red cross fana be mararin bunda men na o fana be jele ninja hal kudaɓe je me alon ko anata jata kende ala karolla ministry of health wala ɓe mararin wo kuwala
That was excellent, Bintou.
It's not easy, but we do what we can. We do what we can. We have to cater for everybody, for all the followers, all the listeners.
Absolutely.
It's very important to do a portion in local language, and we will try to do a full program in local language, and in fact, in various local language as we go. We started doing with the Wolof, the Mandinka, the Fula, and we will try to add more languages as we go, whereas it's possible and we have the capacity. But for now, we'll try to do versions in Mandinka and in Wolof and in Fula. Yes, so I think that's what we can do according to our capacity. Just to give a bit of information regarding that young man, to just bounce back on the situation of that young man that was found in the streets, lying down in the street with a condition that could not really be identified. He has been picked up apparently by somebody, and taken to the hospital. And it seems as if he was suffering from a mental health issue. And is currently with Tanka getting treatment.
Okay, so thank God for that. It wasn't COVID-related case. But just imagine if it was.
Thank God for that, yes. It could have been COVID-related case, and
it
that
could have been a COVID-related case as well, because right now we can't be having the public take that responsibility, you know, because we're telling the public to to isolate and keep their distance and all these, you know, regulations that's been put across by the WHO and the ministry, of course. So I think the ministry has to have something in place for that, just in case, because people are scared out there. And I think that just imagine if the guy had COVID. If he had COVID, then we'll be worried about
that would have been dramatic.
Yeah.
That would have been dramatic.
From one point to another, we would have been talking about 10, 20 people infected.
Yeah.
You know, and that's not what we need at the moment. So I think, you know, this is a good thing that, you know, it was just a mental issue thing, mental health thing, and not COVID. So thank God for that.
Yeah, that story was quite scary. In fact, when we heard about it, I mean, I read it online, and I just imagined the scenario and everybody moving away from that person, and that person lying down in the street for hours without getting any help whatsoever. Nobody was there getting close to that person. out of fear that he might have COVID-19. So,
Yeah.
I mean, if that situation happens, and I'm sure that it's happening elsewhere, and there's not a quick response to attend to that person, then what happens? This is how we see people fainting and dying in the streets because they are not getting the first aid, I would say.
Yeah, this comes back to what I said the last time when we did this, and I said there are other issues as well apart from COVID-19. There are people who suffer from mental illness. There are people who have diabetes. There are people who have heart disease, cancer, and other illnesses that needs attention. So at this moment in time, I think the focus with the ministry, I don't work for the ministry, but the focus has been on COVID, and these people are going to suffer too greatly. And I think we need to not neglect these people as well that would need the ministry's help or would need to go into hospitals with regards to this. So if someone was diabetic and they just fall, Gambians are known to help each other. Gambians are known to see someone in distress and just run towards them and help them. And now that's not going to be the case.
No,
so we need to make sure if that person had a heart attack or anything, they would have died. And it would not have been because of COVID. It would have been because of something else, something different. So I feel like, yes, the focus on COVID is important. The focus on the virus is very important. But we also have to not neglect those other people who have other illnesses that are as important and can be a risk to their lives.
Indeed. And another worrying situation also, another worrying thing is the case of malaria in the Gambia also, knowing that we are in the rainy season at the moment and many people might have the malaria or having the symptoms, knowing that the symptoms that are being described by COVID patients or people who have recovered from the COVID-19 sometimes come out with this explanation regarding the symptoms that they used to feel or that they are currently feeling that resemble a lot with malaria symptoms, So people can clearly be doing some automedication at home, believing that they have malaria and refusing to go and get tested. That's also another issue that's quite worrying. And in the meantime, obviously, they would be, if they are positive, they would be infecting other people along the way. So how do we just try to contain this community transmission as it is, knowing that some people will not, in any case, go to the hospital?
Sensitize. We need to sensitize and we need to educate, like we said before. And there are many ways of doing that. And I feel like the general public as well, they need to take responsibility. If you have certain symptoms and you're not 100% sure, you can't do a self-diagnosis. You can't sit down and think, oh, it's just malaria. There is a virus that is killing people. You need to make sure you go get tested so you can eradicate that. So people need to take this very seriously. And this is the reason why I've said, for instance, let's say there's a Bakari somewhere who lives far away from the test center and cannot even afford to go to pay taxi to go to the test center area. If there was one local to where he lives, he could just go and get himself tested. So there are so many other things and reasons that is stopping people from going to get tested. Some people have a phobia because they think they're putting that thing up your nose, but that is going to save your life. It would save your life too. So I feel like we need to sensitize people, not just us, the government as well, the ministry. They need to also go out there and let people know, yes, it's malaria season, but if you do have any symptoms, here's where you need to go so we can eradicate it's malaria that you've got. So that is very, very important.
It's a very complex situation, I think it's a very complex situation. I'm saying this because you have the case where some people have gone to the testing centers and could not get tested.
Mm-hmm.
Okay? Or it depends on the amount of people who go to try and get tested. And the fact that obtaining results after getting tested also takes time. In the meantime, what happens? A person who suspects having COVID-19 would go and get tested. In the meantime, what will happen? They will return back home. What if the result come out and they are positive? What happens? It's quite worrying. This situation is a bit, and I mean, we do not have those answers, and I don't know if the health authorities even have the answer. So we'll try and find out more about.
It's not even having. It's not even a matter for me, as far as I'm concerned. It's not even a matter of having the answer. As it stands with COVID-19, nobody has the answer. Nobody has the cure, but we can put in place measures that can limit or slow down the infection rate. So basically, the experts are within the ministry, and I think they need to sit down and think, what are we going to do? It takes 3 days for someone to get their test results. When that person goes home, what are we going to do? How are we going to put a process in place where we can slow down the rate of infection that is going on? And that is for them, with their expertise, to come up with something that the public can adhere to, because the public is here to listen to what the ministry has to say. And I think so far, with example of that boy that dropped in the street and nobody wanted to come near him, people are adhering to the distance yourself from things like that. So they need to also put processes in place, follow-up calls, making sure the person is not going out in their community. You've gotten tested, go and isolate yourself and wait for your results, you know. So it's
I'm
up
just
to the
afraid
ministry.
that I'm just afraid that it all comes down to the issue of capacity. You know, it all comes down to the issue of capacity. When you know that clearly the testing has not even started beyond the greater Banjul area, community transmission has been reported around some regions, you know.
Yeah.
What happens in this case? I mean, there's only one testing centers in the Gambia as we speak, which is the Ndemban Clinic in
For 2
Bakau.
million people.
I mean, you know, this is, I don't know, we can't elaborate on this because we clearly do not have the answers. It's just that we're just raising out these worrying questions, and hopefully solutions will be coming up as we go. We hope, because at this rate, we just the country will not be able to sustain itself at the rate that we're going. Mortality, rate of infection, it's not sustainable. We will all die at this rate.
Inshallah, that would not happen. I hope that the government are listening to programs like this, because we are not the experts here. We are not the ones in charge. They are. We can only give suggestions and give constructive criticism. Like I always say, this is not about pointing fingers, but it's about just showing concern and also sensitizing the masses and also helping, in a way, the government. And I think the government need to listen to platforms like this, need to listen to individuals. And there are experts out there in health that are not living in the Gambia, and they live in the diaspora. They too don't have to be isolated. They too need to be listened to, because they could bring something to the table. Like I said, this is a problem that we have at the moment. It's a virus that nobody understands. Some people can have this type of symptom, some people can have that type of symptom. Some countries have tried to slow the spread of the virus. Some countries are suffering. And this is a time whereby, Amudrus, if you need help, you need to let people know. Speak to other countries, look at how they're coping, how their systems are coping or whatever, and get the help and that they need.
Indeed,
you know,
indeed.
And also create a process that it would help as well. You know, it would help them to minimize what they're going through, and also it will slow things down. Because I could remember when COVID just happened, the first thing that the UK government did was look at what was happening in Spain and look at what was happening in Rome.
Obviously.
Because at that moment, they were the epicenters, remember? And they had a lockdown. So basically, that's the same thing. They said, you know what? We're going to do the same thing in the UK, because we know in 6 months' time, if we leave everybody out there, the NHS will not be able to cope. This
Indeed.
is a developed country in the Western world that, they said it won't be able to cope. So we have to slow it down. And that's the same thing the ministry have to do. I'm not an expert, but I see that's what they did. So they're the experts. They should know this is how we're going to do it to slow things down. We don't have the answer, but let's slow things down, because our health system cannot cope with what's happening, So it's, at the end of the day, it's down to the ministry. When Red Cross is telling you as well, quite literally, it's down to the ministry as well. So everybody is looking at the ministry to come and tell us, these are the processes, this is what we're putting in place, and this is what we have to adhere to. Not just the washing hands and wear mask and whatever else. So it should be way beyond that by now.
Indeed. Yeah. Well, I mean, we're not here to scare people, but we're just here to sensitize and to share the information that we have, and also give advices based on what we are clear about and what we actually can actually advise on. In the case of the community transmission, this is something that's going on at a very rapid rate, and we need to really sensitize each other. We've not seen any report online these past 2 days, I want to say, regarding the respect of the curfew. I want to believe that means everybody is respecting it to the letter. We've not also had much reports coming out from the ground regarding wearing of masks. I want to believe that more and more people are adhering to this rule, and this is the way to go. I mean, we don't have multiple choices here. We have very few choices, and some of the strict measures that the government and the WHO have been sharing with the public is wash your hands, wear a face mask, respect the social distancing, avoid public gatherings, avoid getting too close to people. Always make sure that you step a little bit backward when you're talking to somebody. And when it comes to the health ministry, when it comes to the government of the Gambia, I want to say, under the state of public emergency, there is a curfew that starts at 10 p.m. and ends at 5 a.m. Within those hours, you do not have the right to be seen in the streets roaming around. So stay home, stay safe. And all the other measures are there also. So I think this is something that people need to respect more and more. Whoever has not been respecting these rules, you need to know that you're putting your life in danger and also exposing other people. So we will clearly ask the general public to keep on following these guidelines from the authorities, and then also reaching out to the right authority whenever there is an emergency or a need to consult or to have advices.
Absolutely, I echo that as well. The guidelines need to be adhered to, and it's welcoming news to know there has not been any cases and stuff. I hope somebody was watching and they heard that 20,000 I was talking about. 10,000 balance is fine. And 3 days in Naga in mile 2. So we are making light of the situation, but it is a very serious situation. So I believe that the more we adhere to the rules, it will slow things down, and it would also help it would help the ministry to sort of like catch up, because COVID is like, it's a serious thing. COVID is very, 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 very real. Stay away from public gatherings, wash your hands, wear your masks. If you don't know how to wear your mask or how to take care of them, there are videos, there are people all over the internet sensitizing and letting people know what it is that they need to do. So let's try and adhere to all of this. And let's also stay alive. We need to stay alive. Yeah.
And also clearly, like we always say in all our videos, in all our live videos, share the information with your relatives, call them if they are not connected on the internet to be able to benefit from sensitization videos and things like that. Try to contact them, reach them via the telephones and discuss with them. Let them know about all these measures. Let them know about all these preventive measures. Discuss, share information, and make sure that they apply, advise them to apply some of these things. Even those who do not believe of the existence of COVID in the Gambia, keep on sensitizing them, keep on letting them know about the information that you are hearing, especially from informative platforms. Let them know, and gradually we believe that they will start believing in the existence of COVID-19. It's very important. Some people in the rural area do not have access to internet like we do here in the urban area. Make sure to always relay information, valuable information to them. Let them know about what's happening in the combos here. Let them know about the rate of the infection. Let them know about the number of deaths. Let them know about the measures to adopt to ensure that they protect themselves, and let them know that COVID is not something that's sitting in the urban area, that COVID is something that's also spread across the country. So they need to know that no one is spared.
Yes. And also to the viewers, thank you so much for your contribution. It's really important for us to have this conversation. And we also would like for you guys to share the videos, not just this one. You can share other videos that you see that might help as well. We have to keep it going. We have to keep talking about this, because COVID is here to stay. COVID is not just a 1 week, 2 week. Well, we've been, 6 months now? Almost. So we need to keep it going. We need to keep it going. We need to keep sensitizing ourselves individually, and we need to adhere to the rules as well, because it would make it all easy for everybody that's involved, for the health workers, for Red Cross, for the ministry, and for us individually as well.
Indeed.
So
Indeed.
1,872 people have been confirmed having COVID in the Gambia. 63 people have died, and 401 have recovered. And remember, we've only got one testing center. So how many more don't we know about? So people need to absolutely make sure that they're adhering to the rules. If you have symptoms, call 1025. Alternative numbers are there. Ring them as well. And isolate yourself until you know that you have the all clear. Because if you go and say you're going to visit an uncle, you go and visit an auntie, you go and visit a friend, and you've not been feeling well or whatever, and then you go and get the test, then you find out that you have infected, maybe 10 or 15 people who too need to be tested again. And then that means the ministry are going to get overwhelmed. So we all need to take individual responsibility.
Indeed. A last word in Mandinka, alinga sabati. Kurangonya hapo benyame mbanko kamalong. Sainten testiro be kirin kombo jenne. Testiro man kumase santoto. Kurangonyi be janjandi mbanko kanne. Andu mol be fa kanne. Mol fatale andu ndol be falale. Sai masakunda e menfo. Jata kende abunda mol e menfo wale nyinti ko nga sabati nga fata bengolma. Nkalimbulol ku nkal maskodung. Nimmol fanan kana suti ya nyola akumaya tabakele alinga kata nga okuma kongolta nga okuma kongol muta nga tamandi wonyama kata be nyamen biti lola lopitan jamal be jibe farenne sa ibajalal ko nin kuranto do kabina la fawo mol kan lopitanol ta ata ita kumban nola sa men kumaya ta wala nyinti ko momo ye hakilotu ifanto ye sabati kata nyoya kata nyoji be atara ibe men sam ila bunda ella men ye malon fo mari kuram bala fo covid bala le faman tarala amanko ima katu asitara no amari lale ayatara amari fo malon men ko itaje nga sabati nga kakalta nyoya kakalta nyoji be wonyama katu kuran nyin ka sawunne aka sawna na la sawunyin tariyatal alen han hakilo tum fanto nga kata nga nyin covid bay na banko kan.
Should I do it in Wolof as well?
Of course.
Okay. So I'll try my best. So lu Bintou don jema wax moy ne COVID dafa nek lo xamne febar bu deggu la mu ngi ci réew mi te mu ngi rey ay nit although ñu ngi am ay test center ñu ngi am benn test center boo xam ne foofu la nit ñi mun di dem pour get tested waaye am na ñeneen ñoo xam ne testé nguñ leen te xamuñ lu nekk di xew daal so lu ñooy advice nit ñi mooy ne ngeen def loo xam ne moom leen ministre bi wax mooy ne ngeen toog seen kër yi ngeen raxas seen loxo yi soo leen di génn tamit ngeen sol seen masque yi te ngeen make sure tamit ne yéen a ngi social distance loolu mooy ne bul jege nit yi torop you know so nañ ñu try daal parce que duñ mun a jël yëpp ñu bàyyi ko ci loxo government bi foog ñu ni tamit ñu def suñ bos foog ñu ni tamit ñu def loo xam ne moom mooy dimbale pour wàññi virus bi nu mu nekkee di spreadé so ñu ngi leen di ñaan ngeen toog seen kër yi ñu ngi leen di ñaan ngeen raxas seen loxo yi ñu ngi leen di ñaan tamit ngeen di sol seen masque yi te bu mu em fii tamit ngeen try pour ngeen wax ak seen ay mbokka ngeen try pour jàngal leen ñooñu tamit pour ñoom tamit ñu xam lan lañ war a def pour mun a aar seen boppa si virus gi mu ngi fa soo leen demee si seen marché yi da ngeen dee gis Red Cross ñu ngi ñëw ñu ngi nekk di spray foofu yépp pour make sure ne ñu ngi rey virus bi if it's there or not so ñu ngi leen di ñaan ngir yàlla ak yonente bi ngeen bàyyi seen xel COVID is very very real COVID mu ngi fa feebar bi mu ngi rey ay nit so loolu lañ am pour wax lañ tey daal.
Right. Thank you so much, Manyenya. Thank you so much for your words. I mean, it's very important for the public to get it, for the public to understand, and for the public to digest it, and for the public to apply it, in fact. So we thank all the followers, and we really appreciate all the questions that have been coming through. We've tried to answer some of them, but unfortunately we don't have the time to answer all of them. But be sure that we will be answering them as we go. Since we have been doing these live videos almost every 2 days, I want to say we will keep on doing them, and make sure to keep on following us to get the latest update regarding the COVID situation in the country. And of course, we would always try to bring you relevant, verified information pertaining to the COVID situation. This is what we are here for. Thank you so much.
Yeah, thank you so much to the viewers. Thank you for watching, and also thank you for the support always. Thank you for taking your time and coming to listen to what we have to say. Like Bintou always says in the beginning, we're not experts. We're just here to look at what's been happening in the Gambia thus far, and just try to analyze the situation and see if we can have suggestions, and also just have a conversation. We can't always leave it all to the authorities to do all the work, but us as the citizens of the country also have to take individual responsibility, and it starts with sensitizing each other. So thank you so much. And also I've noticed we've had Haruna Drame. He's been commending us, saying we're doing a good job. Also Fatou Toure is there.
Thank you, colleagues. Thank you
so much. Thank you to the colleagues as well, because they're doing tremendous work. We have to also acknowledge that they are also sensitizing, and it doesn't just take people from the media to sensitize, but also just an individual. If you don't have to be from a media house, you can always do your bit to sensitize. We're all in this together, and we're not going to have half of the people putting holes in the boat and half of them rowing. We're all going to row. We're all going to get through this. We're all going to stay alive and get to 2021, inshallah Rabbi. So thank you so much for having me, Bintou.
Thank you for your contribution. Thank you.
Thank you.
dikluma xamal la ni jar na ko xibaar bi ma la andil COVID-19 mooy corona virus lépp na àdduna li ma jaaxal nag ci moom mooy xàmmeewul bu rek baatoo la tax docteur yi ci àdduna ñoom ñëpp jóg nañu ànd ak ñun ngir yéex leen ba jàngoro ji jóg fii ci suñu askan leen Gambia Red Cross Cross Society ñi di ñoom yónni woon te ma xamal leen ne wéru askan wi moo leen tax a jóg àdduna wërngal képp la doon seetu suñuy vision suñuy yaakaar ñu wekkoon ko ci yow andi loo ñu lu dul COVID-19 yow 2020 diglu ma xamal la ni jar na ko xibaar bi man la andil COVID-19 mooy corona virus lëmbe na àdduna li ma jaaxal nag ci moom mooy xàmmeewul buur ak baadool la ndax docteur yi ci àdduna ñoom ñëpp jóg nañu ànd ak ñun ngir xeex leen ba jàngoro ji jóg fii ci suñu askan yee ITC ñooy International Trading Center ñoo ne ma ni ma yëgal leen ne wéru askan wi moo leen tax a jóg àdduna wërgal képp la doon seetu suñuy vision suñuy yaakaar ñu wekkoon ko ci yow andi loo ñu lu dul COVID-19 yow 2020 tas na suñu yaakaar billaay tas na suñu yaakaar déglu leen ma man te ma joxe tegtal yi ci géetu ñu raxas loxo yi mu set te ñu moytu joxante loxo setal fa wóorul wala ca moytu ndaje mbooloo dafa wóorul askan wi nañu saytu ndaw réew mi te ñu téye leen ci biir kër yi ñu bañ a génn déglu leen ma jubtal suñ soldaar yi ci xeex bi déglu leen ma jubtal suñ soldaar yi ci xeex bi Red Cross jàmbaar ngeen jàmbaar ngeen yéen a ngi ci xeex ba guddi bëccëg ngoon yéen a ngi ci xeex Red Cross jàmbaar ngeen yéen a ngi ci xeex dem ngeen xus dem yéen a ngi ci xeex Red Cross jàmbaar ngeen yéen a ngi ci xeex bi yàlla tekki ñu tiis wi yaay borom yërmande